I'm Cheryl Pederzoli, leader of marketing here at AGS Health, and today I have the privilege of sitting with Tom Spalla, Senior Vice President of Sales here, to discuss some of the industry perspectives he's been hearing in healthcare. Thanks for being here today, Tom.
Thanks, Cheryl. It's great to be here.
From your perspective, what are the most significant shifts or emerging trends you're observing in healthcare revenue cycle management today? And could you elaborate a little bit on those driving forces behind those challenges?
Sure, Cheryl. One of the biggest shifts that we're seeing in trends is automation. That is everywhere prevalent in health systems, but it's all over revenue cycle, whether it's prior authorization or whether it's autonomous coding. We're seeing a lot of automation. Sometimes it's just RPA, robotic process automation. Other times it's autonomous. Other times it's now shifting to agentic AI. But regardless of what it is, what we're seeing is leaders are not just about, we have to put in automation. They're really scrutinizing, what problem are we solving? Is it the right problem to solve? And what is that ROI? So that is what we're hearing from leaders across the board. And the other big shift that we're seeing, besides a lot more automation and what can we automate, is really a shift to ambulatory. So there's a lot of pressure to meet patients where they are. We were recently at a Becker's conference, and a lot of the C-suite, the CEOs, were talking about that shift into ambulatory, which changes, revenue cycle is a little different on the professional side than it is on the hospital. So it really is a big shift in our industry. And the other part of your question was just elaborating on some of the driving forces. It's really challenges with denials is a big part of it, and that is one thing. The other thing is, a good example is ambient care. Ambient care, there's a physician burnout is real. So ambient care has been an automation that has been really listening to the physician's conversation in the background to get better notes for physicians and less work for physicians to do their note taking, and really it's the physician burnout that's driving that, but it is sort of impacting revenue cycle too. One health system has been on the record, Texas Health Resources, one of the largest health systems in Texas, has said that by having that ambient, they're actually capturing more revenue per physician in their organization. So those are just a couple of the driving forces.
When you speak with hospitals and health system leaders, what are some of the most common pain points or frustrations that they're express regarding their current revenue cycle operations?
Yeah, well, we talk to a lot of organizations, and I've been in this industry over 25 years. It has not changed. It's still denials. It's amazing, and I think the proliferation of denials it's worse now than it has been. It's actually, there's some studies that show the last couple of years there's been a spike. 2 years ago it spiked 50%. Last year it spiked over 100%, and maybe. Probably part of that proliferation of denials is because of Medicare Advantage. There's probably a lot of other reasons as well, but Medicare Advantage is growing. So even though some health systems have dropped Medicare Advantage, it's still, they're adding, most are investing in there, and it's getting bigger. So we don't see denials slowing down, and that really is the biggest challenge, and that is underpayments. Now that can be considered a denial. So we're talking to health systems too right now that are still not adequately staffed to go after underpayments, and it is a major challenge. Prior authorizations are one of the other big causes of challenge, and why we're trying to automate as much as possible in prior authorization. And actually there's a lot of companies out there that are focused on automating prior authorization, but the interesting thing is you still need humans in the loop. One health system told us, we're automating prior authorization across the board, but the reality is we're only getting about 18% truly automated, right? So there's still humans that need to go in there and do the work, and there's a lot of manual effort. So number one is definitely denials, but there are other challenges too. Workforce challenges are real on the clinical side, as well on the revenue cycle side of the equation. So getting good people and retaining them is still workforce is still a challenge. Sure. Another example of a pain point for health system leaders is the increased dependence on government payers. One health system, Penn Medicine, threw out a statistic that in 1996 their dependence on government payers was 40%. Today that number has grown to 63%. So it's, Medicare and Medicaid is not getting smaller, it's just getting bigger.
What innovative solutions are healthcare leaders using to help improve their efficiency, reduce costs, enhance revenue integrity within their own organization?
Well, I mean, again, innovation is the big thing, and there's always humans in the loop. But interesting, it's actually seen at some organization is to get more innovative within their organization, to start looking at global resources, and of course automation is big too, and we're using tech-enabled solutions here at AGS in every service that we do. We try to bring some sort of tech into the equation, but a lot of folks are seeing it innovative to let's look like before we hire more staff, or we have before we do anything, can we do this globally? Because there is a significant cost savings that can be reallocated to somewhere else in the organization that really needs it. So believe it or not, that is in some areas, we're seeing first time global outsourcers every year.
What are the biggest misconceptions you encounter among healthcare leaders regarding revenue cycle management, and what advice would you offer people regarding these challenges?
One of the biggest misconceptions, and we were just talking about global outsourcing, one of the biggest misconceptions is that you can't get as high of quality using global resources as you can domestic resources. And the interesting thing is, we've been in the market for well over 10 years now, 14 years in the marketplace, and it's really gotten to the point it's exciting, because we use automation even in our AR services. There's so much technology in the background to make things more efficient, to make our quality higher, and we've proven it with different third-party resources that look at us at different areas like coding, or maybe it's AR, extended business office, and we've won class awards. But it's just it's exciting that the quality has gotten so good that it really is. It's not it's a misconception, but it shouldn't be. And we're really educating the market to make sure that that's not a misconception anymore. And it's exciting what technology can do to change those perceptions.
So it sounds like your advice is to educate yourself before you just decide that that's not going to work for your organization.
Yep, that's absolutely correct.
Looking ahead, what do you believe will be the most critical capacities or investments that healthcare organizations will need to prioritize in the revenue cycle over the next 3 to 5 years?
Yeah, I mean, I think, just to kind of summarize a lot of what we talked about, it's really tech transformation, right? It doesn't matter, you've got to jump in somewhere, and I think that a lot of health systems are doing it the right way. They're figuring out what problems are going to have the most impact, and let's find out how we can solve them, whether that's through autonomous in the area of coding, which we're excited to be in that market because there's a lot of energy around it. But whether it's autonomous, whether it's future agentic AI, they just need to continue that transformation and keep up with the payers, frankly, because the payers are going to continue to have technology on the other side, and so they need to keep up. So that is number one. And the other thing I would say is the continued focus. It's the right path that the C-suite is taking to move more towards the ambulatory market.
Thank you so much for joining me, Tom, and sharing all the insights that you have from industry leaders. It's been really great to learn a little bit more about what you're experiencing.
You're welcome. It was great being here.